Are you one of the women out there that have reached the age of menopause? We know that when you reach menopause, you basically have an increased risk for cardiovascular disease. In fact, all age-related mortality starts to increase at the time of menopause. Estrogen is protective because of its activation and stimulation of nitric oxide production. So at the time we reach menopause, in men, in women, we lose the stimulation, the activation of nitric oxide production. And that's what leads to an increased risk. So we can do hormone replacement therapy. We can restore the natural production of estrogen in women, testosterone in men. But until we restore the body's ability to produce nitric oxide, we lose the protective benefits of hormone replacement therapy. So loss of hormones, loss of nitric oxide. Loss of nitric oxide, further loss of hormones. There's nothing more life-changing than a developing baby, bringing a new life into this world. There are a lot of things that have to occur. It's almost the miracle of childbirth. When a sperm and an egg meet, and then 9 months later, we get a breathing, live human being. We take prenatals because we want to provide the body with the nutrients it needs to support that growing baby. You can have all the nutrients on board, but if you can't adequately deliver those nutrients to the growing placenta, to the growing baby, then it's all for naught. Nitric oxide is what dilates the blood vessels, allows for the adequate delivery of oxygen, those vital nutrients to support that growing baby. We know in certain conditions like preeclampsia, where we get an elevation in blood pressure, gestational hypertension, gestational diabetes. All this is due to a lack of nitric oxide production. We need to give that growing baby the nutrients it needs, the oxygen it needs, and that's dependent upon nitric oxide. To breastfeed or use formula. We know there's the health disparities between breastfed and formula-fed babies. So the obvious decision is you should breastfeed if you can. Now, what are the protective benefits of breastfeeding? We know that it's a transfer of immunoglobulins to help the immune system. But we published more than 10 years ago that the benefits of breastfeeding have a nitric oxide component. Because when babies are born sterile, they don't have the bacteria needed to metabolize or to produce nitric oxide. So the human body has developed a really beautiful system to deliver bioactive nitric oxide through the breast milk. And then when the baby becomes colonized with nitrate-reducing bacteria, and the breast milk is providing nitrate that the baby can then convert into nitric oxide. And mechanistically, that what leads to cardioprotection, lower incidence of cardiovascular disease, diabetes later in life. So the obvious choice is to breastfeed.